Hello, my name is Troy Warfield. I am the Hope Cancer Resources Public Health Internship for the summer 2021 academic semester. We're just going to be going over my internship overview and just kind of what is entitled in that. So number one, Hope Cancer Resources is a nonprofit that is focusing on providing resources for those who are on a cancer journey. So that can either be anyone who has cancer or someone who is help them with their cancer and have things go like that. My internship preceptor is Hannah Edwards. She is the wellness specialist at Hope Cancer Resources. She maintains the wellness center, which is where people can come and work out based on like their health needs. I am the public health internship, so as to form my title as the health education intern. However, there were two social work interns there, Chloe Swan and Madison Shearer. They're not required to be in the video. However, I thought it was important to mention them. The mission statement is to provide compassionate professional cancer support and education in the Northwest Arkansas region today and tomorrow. And the vision is to provide hope and enhance quality of life by expanding prevention, wellness, comprehensive cancer support services in our region. So that includes Northwest Arkansas and the 4 counties that I will mention in a little bit. Our goals are specifically to provide support services and education for our community. We strive to recognize and maintain the highest possible standards to the extent permitted by our resources. We are a nonprofit, so we don't have a giant budget. However, we do try our best to help people in their cancer journey. The target population is cancer patients, so those who are currently undergoing treatment for cancer or have undergone treatment for cancer as long as they've been diagnosed, or those helping care for those who have cancer. It is limited to individuals who are seeking treatment in North Arkansas in the 4 counties, Benton, Carroll, Madison, and Washington. However, this doesn't necessarily mean that they live here as long as they are just coming here for treatment. So they can come from pretty much anywhere in the United States or wherever, as long as they're seeking treatment in one of the 4 counties, they're able to receive our financial help. We offer various patient services. I have listed the larger ones here, as long as people who help direct them, so transportation to and from services. A lot of times people with cancer need help with that. So we have Jerry Carter who helps organize that. We have social work services, who is led by Julie Kynes and 9 other social workers, not including the interns, and they help with financial assistance and emotional support. Spanish interpretation by Rosa Brewer as well. One of the social workers also speaks Spanish, so they help with providing Spanish interpretation for those who might need it and seeking our services. And then education and outreach, which is a specific area that I worked in, that is under Alicia Atwood and Hannah Edwards. Again, Hannah Edwards is the wellness specialist. She works in the wellness center, and she is my internship preceptor. However, Alicia Atwood is the tobacco cessation program director, and she is also someone that I work closely with. And just a little bit more on these two. So Hannah Edwards specifically has certifications that help her treat those who have cancer with physical exercise or physical training, things like that. And then Alicia Atwood is nationally recognized to help treat those with tobacco use or nicotine addiction and helping reduce the amount that they use to overall lower their risk of cancer. One of the major projects that we worked on was Skin Cancer Screening Clinic. It was a free clinic with local partners from dermatologists in the area, intended to provide resources that would help lower the risk of skin cancer later on by early detection and things like that. It ran this previous Wednesday, July 22nd from 6 to 8 p.m. We saw about 70 patients, which is down from what we typically see. However, this is largely due to COVID and things like that. And then just generally disseminating dermatologist information for further treatment if needed. The skin cancer screening specifically worked on 2 different NCHEC competencies. Number 1, area 3, implement health education and promotion with specific sub-competencies in 3.1.3 and 3.4.3, as you can see on the slide. And then area 6, which is serve as a health education and promotion resource person, sub-competencies in 6.1.5 and 6.3.1, as you can see on the thing. I also work closely with the Wellness Center and tobacco cessation, so I'm going to go over a little bit about what that is. So we had various projects that we worked on in the Wellness Center, so just general maintenance, replacing the flooring, and helping kind of ensure the space is better for those who are utilizing it. Stage of Change project, which is just we use the transtheoretical model to place those in the Wellness Center into areas that would help them further reach their goals and things like that. Community outreach and attend classes, so I actually have to both help organize and be a part of the wellness classes, yoga, fitness, and things like that. They each require different skills and unique problem-solving challenges. So I'm just kind of in like a little bit of handiwork, a little bit of communication, overall things like that. Main objectives are improving the space aesthetically and functionally for those who are using it, weekly maintenance, and then experiencing actual practical application of public health information and design programs. Tobacco cessation, the nicotine replacement therapy, order fulfillment and calls, which is just helping those who are currently addicted to nicotine, lowering it through like patches or gum and things like that. Patient intake calls, so just sitting in there and listening to patients and how to best serve them on their reduction in their nicotine use, and then program supply and upkeep maintenance. Specifically, the objectives I've worked on were follow-up, nicotine replacement therapy follow-up, and dissemination within 1 to 2 days of calls, so making sure it got out in a timely manner, inventory maintenance, and then community outreach. And then these specific competencies that they worked on were Area 1, which is success needs, resources, and capacity for health education promotion, with subcompetencies 1.1.2 and 1.6.5. And then Area 7, communicate, promote, and advocate for health education promotion and profession, subcompetencies in 7.1.3 and 7.1.7. So the overall review of my experience is what have I have gained? I have gained direct community interaction, public health education experience, design, follow through, and review of different programs, health support, knowledge, and networking, which will serve me well in the future since I want to be an infectious disease epidemiologist. And this allows me to understand that both the theoretical application of the public health ideas that we're learning now and like the actual practical application and what like a good follow through is on that typically is, especially in some of the more needing populations. And then what has Hope Cancer Resources gains? So new perspectives and ideas. Short-term intern, I have a lot of fresh new experience and I've just learned a lot of information, so they kind of use that and ran with it. Large community outreach, improved organization, and then more time for community members because of the improved organization and time. If you are interested in interning here, reach out to Hannah Edwards, who is my internship preceptor. Her email is listed on the board, as well as some other contact information for Hope Cancer Resources. And if you have any questions, you can look up some of the information on their website. If you know anyone with cancer or anyone who is on a cancer journey, you can direct them to the website and they will help them as best they can. If you have any questions, please feel free to contact me, and thank you for your time.